Triboluminescence is the phenomenon where when you have a crystal and you crush it, it gives off light. And so this instrument, basically, we crush the pharmaceutical formulations, and if any light comes off of it, that's directly proportional to how much crystallinity is in the formulation. We started off with this simple idea. I had this, we wanted to impart a force to this powder, so I got a long metal tube and stuck a ball on top and dropped a ball from, 2 meters, and we were hitting the powders with that. And it was messy. It took us a long time. We didn't have, it took us about 10 minutes in between one hit to clean everything up and get a new sample ready. And so we went to the AMI facility and asked them to, if they could help us, make this process more consistent, faster, just better in general.
And so with that very open-ended problem, we took that here and brainstormed some solutions to that and came up with the instrument that you see here. So the primary striking mechanism is a solenoid, an electromechanical device that takes an electrical current and turns that into mechanical motion. It's something you would find in your car's door locks. The other mechanical component is the motor for moving the translation stage. So every time you want to reveal a fresh piece of sample, we turn a motor to move the sample and strike it at a different place. There's a photomultiplier tube underneath that picks up on the photons released from the crystals. So they have they're standard microscope slides that they've specially made with a slot down the middle, and they can spread out any kind of pharmaceutical substance they want, or sucrose if they want to just get a baseline signal. And then they coat it in electrical tape so that when it's impacted by the smasher, it doesn't fly everywhere and they lose their sample.
Certain pharmaceutical formulations, crystallinity is bad, where if it's crystalline, it's not bioavailable. And so it's a big problem that the pharmaceutical industry has really tried to tackle, as to how to quantify this crystallinity, how to measure how much is in their formulations.
And we're thinking this technique could be more like a pre-screen, like off of an assembly line in a factory or something that they're making these drugs. They can just send a small amount of the material into this machine or instrument for triboluminescence measurements, and if they get a positive outcome from the sample, then they can send that off to more rigorous testing.